Hi, Terry Kuti with DiepCFoundation, and I have the honor of interviewing a breast cancer survivor today. This is Terlisa Sheppard, and Terlisa and I are both at the San Antonio Breast Cancer Symposium this year as patient advocates. So I'm going to let Terlisa tell you about her breast cancer story, and we're going to lead in with some questions about her breast reconstruction. So thanks for joining us today, Terlisa.
You're welcome, Terry.
Yeah.
Well, I'm Terlisa Sheppard, and I am a 4-time breast cancer survivor, HER2 positive, well, actually triple positive, with mets to my bones, lungs, liver, spine, abdomen, and brain. Yes, in all of those places.
I want to rub you for good luck because you look so amazing and so beautiful.
Well, thank you. Thank you. And I am a 19-year survivor. 16 of those years have been metastatic. 14 of those years I've been on the same drug, Herceptin, and still fighting along. Mm-hmm. I started this journey when I was actually 8.5 months pregnant with my second daughter. And my oldest daughter was only 2 years old at the time. So you can imagine that I had a journey going through this. Mm. But through it all, I am completely blessed. And I actually started a small nonprofit breast cancer organization. Oh. Yeah, and it's called Terlisa Fights Breast Cancer Incorporated.
Yes, I follow you on Twitter.
Yay. And through that organization, I enjoy mainly mentoring other survivors and giving them hope, mm-hmm. sharing my story and testimony, and of course, helping out with, small bills or trips to the cancer center and just sitting in on some of the appointments with them.
Wow, that's amazing work.
Thank you. Thank you. I enjoy it.
Yeah. So, Terlisa, tell us, you had a tram flap back in, I shouldn't say back in, but it was in 1999?
Yes, 1999, and it's sort of back in.
Yeah. Yeah. So tell us basically about how you found out about your breast reconstruction options and just your whole experience with the tram flap and the healing process. You had young children at home. You had just been through some treatment. It's quite a story. So please share that with us.
Oh, most definitely. My starting out with the surgery, I just coming off from having a baby, I was sort of rushed into chemotherapy treatments right away to get the tumor to shrink some before going into the surgery, actually. And after that, did radiation. And then it was time, I was diagnosed November 1998, and going through chemotherapy and radiation, it got me around to about June timeframe, June 1999.
Right.
And at that point, we started scheduling the surgery, which was doing the tram flap surgery, reconstructed surgery, of course, for July 6th. I know that date just like it's my birthday.
I bet you do.
So we set it up for that day. And at that point, right before that, just, how you go in and doing your pre-registration and everything, talking to the surgeon and everything. That is when I was given some of the options, would you like to do lumpectomy or mastectomy? Mm-hmm. And 31, 32 years old, I had no idea what I wanted to do. Mm-hmm. Still scared, very scared, not knowing what to expect.
Right.
And this was 1999. Mm-hmm. Now it's 2017, and we have all kind of advocacy work going on. We have classes, conferences that, that's giving young ladies and men, men and women, information on all of these types of surgeries. Well, I didn't really have that at that time.
Yeah, plastic surgery has developed with their techniques and their options too, just like with all the discussion this week about all of the new studies, the clinical trials and everything that's coming up in breast cancer. So too has plastic surgery come along since you've had your tram flap. just in the different kind of options, and I think in honing. That's not the right word, but developing and making these procedures better for women and men.
Yes.
Yeah.
Yes.
So,
but I, carried on and sitting with my breast surgeon. We made that decision. We had a sister that was sitting along with me.
Okay.
And we decided to go along with the mastectomy, left breast mastectomy with tram flap surgery, reconstructive surgery. And with my procedure, I ended up doing it the same day that I had the mastectomy, actually.
So
Immediately after having a mastectomy, I had reconstructive surgery.
Okay.
All in the same day.
Okay, so your breast surgeon came in first, and then shortly after, the plastic surgeon came in to finish up with the tram? Is that how it works?
Absolutely.
Okay.
Absolutely. So I had it all done that day, and carried on after that. Right.
Well, it's amazing to me the amount of treatment, the amount of surgery that you have been through. So I hope that our advocacy work together can continue to educate women and men about, what their options are, whether it is to have only the lumpectomy. Now I know today they do something called oncoplastic surgery. Well, it's not just today, but they're developing that technique too, where many oncoplastic surgeons are using the existing tissue that women have after a lumpectomy and moving it around rather than doing an entire reconstructive process. So that's something too that they're also offering for women today. But I think it's so important in our advocacy work to let women and men know what their options are. So
absolutely. And I'm glad I made the decision that I made. So to say, I ended up after having two babies right next together. I end up removing those tissues from my abdomen to form the breast. So,
So can I ask you a bit of a personal question? You had two young babies at home. So with the tram flap, you did not have the option to nurse your children then, correct?
Absolutely, Terry. And I was actually sort of in shock when I first got the news that I had breast cancer.
Yeah.
That is actually one of the first questions that I asked the breast surgeon. She was the person that did my biopsy. And she asked me, did I have any questions? I say, so would I be able to breastfeed my daughter? And she sort of looked at me like she either is in shock.
That you asked the question but a great question.
But I had breastfed my first daughter for 7 or 9 months, and just that was one of the things I was so looking forward to.
Absolutely.
And I guess that's what was on my mind. And, we'll come up with some of those either naive thoughts, questions, or even misinformed. So something like this is great to inform the audience.
It is, because that is something that a woman has to give up, a young woman who has children or who is thinking about having more children. If they've had breast reconstruction and post mastectomy, and then they go on to have breast reconstruction, if they choose that, breastfeeding is no longer an option.
No longer an option.
So I'm sure that was really tough for you.
That was very tough, having that closeness with your baby.
Absolutely.
But, that's one of the things with going through what we go through having breast cancer.
Yeah, exactly.
Unfortunately.
Well, listen, I really appreciate you sharing your story with us today. It's so meaningful, and you look wonderful.
Thank you.
It's really been good to see you here at the conference and to share the advocacy work that we're doing. And we're really glad that you're on Deep Sea Journey, the Facebook page. So
absolutely. Any way that I can help share my story and be an inspiration to others, I'm up for it.
I think you hit a home run on that today.
Hey.
Thank you so much for being here.
You're so welcome, Terry. Thank you.
Uh-huh.